Yes, my friends, today is a good day, a Sunday. Oh, Uncle is here, a Sunday, and I've been away, but I'm back. I've been away, but I'm back. Some of the people have asked me where I've gone, but I'm here, my friends. I'm here. Thanks for Uncle for tuning in, and let's get talking about medical issues. Let's get talking about medical issues. Um, no topic of today is not just a topic, but we talk facts about medical advices. Facts about medical advices. We can talk about that. Why should we get greetings, welcome, Jamaican uncle. Greetings to you too, Jamaican uncle. Greetings to you too, uncle. And I've been away for some time, and yesterday I couldn't come online. Today is a good day. Let's talk about facts about advices. Why should we advise people about medical issues? Why should we learn about medical issues? Why? And we talked about this the other time. We talked about this the other time, and it was thanks you so much for miss you yesterday, man. Yeah, yesterday I got up on several things here and there and some occasions. So whoever you are watching, my friends, this is Benjamin the Wise Guy. If you are new to the channel, you can come to the chat, ask us what we do here. The channel is called Benjamin the Wise Guy. John Aaron, welcome to the channel. Hope John Aaron, you have subscribed to the channel. Don't fail to subscribe. We talk about medical issues. We deal with some issues. We give topics and discuss the mental health issues. Chinara Agustin. Welcome, Chinara Agustin, to the channel. If you are new to the channel, tell us where you are watching from. It's important, we know where our subscribers are. I'm doing good, Chinara Agustin. Which country are you from? Tell us where you're from. And John Aaron, which country are you from? Hope you guys are subscribing as you come in, so that we can have a good community. Welcome, my friends. Why should we have facts about medical issues? Some people live and they say, as much as I got money, I'll just call a medical practitioner and come and help me, or I just work in hospital. There are so many things that are important when it comes to medical talks and medical knowledge. Medical talks and medical knowledge is very important, and that's why we come online and discuss them. It saves lives. It does so many things, for which I'm going to go through them. So you who is watching, tell me where you're from. I can see John Aaron, Jamaican uncle, and Chinara Agustin. Which country are you watching from? And what topic would you like me to come with one day? Because the topic I come with is shared among the people who are watching, and is shared among the people who are inside here, coming to discuss with Benjamin the Wise Guy. So what are the facts? Chinara, Jesus bless you. Thanks, Chinara Agustin. Chinara, which country are you from? Thanks for your blessings, man. Thanks for your blessings. John Aaron, thanks for tuning in. Thanks for doing, which topic do you really want to know? Would you want us to talk about? But the fact right now is we want to discuss why should we get a medical advices. Why is it important? It is very important, even if you have the finances, even if you have financial muscle of the things that you need, but the knowledge also saves lives. The knowledge also saves lives. Let's see the facts that are needed and why we should come online and talk about. Why should me, Dr. Ben, come online and share medical advices to everyone? Why? Because even the experienced out there who are watching can come and give me. Are you alone? Alone in which capacity, Chinara? Tell me in which capacity, like here or alone in which capacity? Welcome, my friend. Welcome. I can see more people are tuning in. So if you are tuning in, it's the first day. Don't scroll. Don't just scroll. Check down there. There is a subscription mark. You subscribe and like. You like. But we are talking about why should we come online and discuss about medical issues. Why should we come online and discuss about medical talks? It is important. The first fact is medical advices. That is the first fact. Medical advices prevents diseases before they occur. When I come and talk about diseases that are fecal-oral, diseases that are from when you eat food, about sanitation, they occur, and you know what to do. You see, you are preventing the disease. Doctors and health workers teach people to avoid illnesses through vaccination, healthy eating, exercise, and hygiene practices. Fecal-oral hygiene practices, healthy eating and exercises, chronic diseases like hypertension. You see, that's why we come online and advise people, stop eating this so much, stop doing this so much. If you go back to the channel, and you will see so many videos, we have talked about hypertension, we have talked about several things. We have talked about issues that are concerning the real things that happen in the society. And if we can, even cancer, when we were talking about cancer, you notice that exercise and healthy eating and even vaccinations, like the cervical cancer, we talked about vaccinations, you check. So medical advices helps to prevent before they occur. Because if you have the knowledge, I'm in Trinidad, Trinidad and Tobago. Big up Chinara Agostino. Welcome on the channel. Trinidad is an island, and they like reggae music like me. Yeah. I can see the coffee cakes. Can see you here. Thanks for coming in, and blessings also. Blessings always. As always, you have coffee. I have green tea. As always, Coffee Cakes has coffee and I have green tea. So if you are watching and you have not subscribed, please check if you have subscribed. We continue. So the first point we have said is medical advices help prevent disease before they occur. Medical advices help prevent disease before they occur. And there is something else here. Early medical advice can detect health problems sooner. When you start feeling chronic headaches and you are buying painkillers every time, it could be a sign of something that is coming and it's bad. So the knowledge you have can lead you to go to a doctor to check what is happening. And when you check what is happening, it can make you to avoid complications earlier. Birthday is June 15th on Monday. Chinara Agostine has a birthday. Wow. So Chinara, you'll come to the platform, we sing for you. We wish you happy birthday to you. That way. Chinara is from Trinidad. Anyone from Trinidad, say hi to Chinara. All my friends in Trinidad and Tobago. Now, seeking advices when symptoms first appear can help identify disease before they become severe. Advices coming online, watching Dr. Ben talking like the way I'm talking here, can make you identify a complication earlier so that it can be tackled with more earlier before it becomes a bigger complication. So don't always just watch Dr. Ben. Subscribe. Maybe something can come here. This is D Law. Hey, that name. DF DHIHDF. How? Please help me read your name. Did. Hello, I'm fine, D. And fine too to the chat. Your name, how can I spell that name? Did. Did. Welcome. Hope you have subscribed. If you are coming in and you have not subscribed, just check and subscribe. Check the subscription and subscribe too, and we continue and feel good. So I will subscribe. Say okay, thanks. Subscribe and like. And like, which country are you from? Your name is giving me hard time to spell. They give me a name that I can be calling you when you are here. That is hey. Welcome to the chat. Did welcome to the channel. I can't spell that, man. And not all medical advices applies to everyone. Not all medical advices applies to everyone. People differ in age and gender, medical conditions, allergies, and lifestyle. So advice should be personalized. And that's why when we come in this channel, we talk about everything: mental health, heart conditions, lifestyle conditions, all those conditions that you understand. We come here and we talk about them. We talk about issues concerning being happy in life, avoiding confusions in life. We have talked about those are in the playlist of mental health. So not all medical advices are general. Some of them are personalized. You see, there are some people who are born with neural tube complications like autism, ADHD, attention deficit hyperactive disorders. You see, those are things that we talk about and specific person benefits or apparent benefits from. I have thanks, you have subscribed, thanks a lot, and share this video. Which country are you from? Please, anyone can spell that name. Hey, that one is a good one. A bomb, you know. Not all medical applies to everyone. Go to my channel, you will see so many medical advices. I have to go. I'll come back soon. Thanks for your subscription, Div, and your like too. I thank you for being in the channel. That is good. And always, you are welcome to the channel. And if you have any question, always just come and ask. Now, we have another one that is important. Chinara Agustin is saying something there. Chinara, expound on your text. We understand. So, qualified health professionals are the best source of medical advices. Like me, I'm a qualified health practitioner. Me. They are the best, and others that come online and talk to you and out there and talk to you. Don't just go for medical advice to people that are not qualified. Why? The person may be giving you myths instead of facts. Doctors, nurses, pharmacists, and the trained professionals are important when you come to medical advices. Don't cornering. If you start going out for other medical advices to people that are not qualified, you may end up in juju people, in people that do some stuff that are not needed, you know. So you find a person, and you know how people know how to know how these Kingsley is here. I usually say I'll call Kingsley, and then things come and overwhelm me. Like yesterday, I didn't even talk to Jamaican uncle. Kingsley, I'll call you. I really need to talk to you about something medical, but it's okay, I'll call. The only thing you've noticed, Judy, is currently I've been tight. Even coming online is a problem. Like yesterday, I couldn't even make a live stream. So we are talking about, welcome Judy, welcome to the platform. Thanks for tuning in. Thanks for tuning in. And I was saying that when you're finding medical advices, please find medical advices from qualified people. Don't find medical advices to people that have no knowledge. People don't have any knowledge in medical practice. You are the ones who are going to talk to them. You may do more worse than help to yourself. You know that. You may do more worse than help. So medical practice is a wide practice, and that's why we have several categories. We have pediatricians, we have clinicians, we have doctors, we have doctors' assistants, we have neurologists, we have gastroenterologists, we have cardiologists, we have all those ones. But it's important to find someone like a nurse or a pharmacist who is at reach so that you can get medical. It is important to have some medical tips for you to avoid complications in future, and also avoid what? Being misguided. So many people have been misguided out here, and in the name of some medical advices. So medical advices is based on scientific research and not theories. You can, when you have a theory, you gotta have a proof and test the theory for evidence, before it becomes a fact. So for medical advices, they are based on scientific researches, and these researches have undergone tests, and the tests have been passed. We call them quality checks. Before we come and tell you that this drug cures here, or you need to do this, it has gone through scientific tests before it becomes a fact. And that's why when you go to a hospital with so many antibiotics, but a doctor chooses a specific one. Sha Travels in the house. Sha Travel, how is you, my big sister here, Sha Travel? How is you? And what is the time where you are? It's a Sunday, like Dan. Thanks, Sha. Is it a Sunday where you are? Here it's a 4 p.m. about to go to 5 p.m. So we are talking why it is important to have medical knowledge and find the right people to get the knowledge from. You don't just get knowledge from anyone, And I know most people don't like medical talks. Yes. Bless my brother and you, Dr. Ben. Yes. Thanks, Asha Travis. Many people don't like medical talks because if you have never been faced up with a situation, if you have never been faced out with a Wamwandu, thumbs up. Wamwandu is here, my friends. You check Wamwandu out. Wamwandu, how is the going? Today I'm just here talking randomly and discussing why medical talks are important. Yeah, I've been tight the whole weekend from Friday. So yesterday things became so hard. Even coming online, I was just on Jamaican Uncle channel, chatting randomly. chatting randomly. So today's topic is why should Dr. Ben come online? Why should another doctor talk to the people, sensitize the people about medicine, medical tips and health? And as all is well, bro. And the grind as always. Thanks, someone. It is very important. Being misguided, and then you end up. Sometimes in medical field, when we are working, a patient can come to a hospital with a bunch of papers, from this hospital, from everywhere. This patient has gone around seeking for help from several people with no help. But sometimes you come and discuss with other doctors and then you find out that it was a simple thing, but this person was going around the wrong people, being sent to some tests that are not even necessary. You see, some tests that are not even necessary. The idea of going to a hospital and then, without thinking loud as a physician or as a doctor, you start giving prescription of requests of radiological tests and laboratory tests that are not needed is not good. A person was trained as a medical practitioner to think directly and send a patient to the laboratory for a specific test so that it can be evident to what this doctor was thinking to treat this patient as regard. But you can find some people, you go to a hospital because someone has no idea, write several tests, and the test that you are being written for is financed by you as a patient. No insurance, nothing. Abina, doctor, when I eat something early in the morning, I vomit. Why this happen and how things I do outcome this. Abina Konsaujam. Abina, are you a man or a woman? If please tell me, are you male or female? You know, sometimes when your names confuse us. If I know that, I'll have to explain to you that. Are you female or male? So when you do this to some people as a doctor, I am a man. Or sometimes when you wake up, Abina, there are some things called hormonal imbalance. I would like you to, there are some things I can't discuss openly here. And Abina, if you have my number or my email address, send me an email, I'll explain to you. Some things are confidential. Let me not, there are some situations that can enhance nausea when you are waking up. And because it is a direct thing from a person, let Abina email me so that we can discuss more about it. Abina, I will text me on benjaokwesh@yahoo.com. I'll advise you privately about that. benjaokwesh@yahoo.com. I'll advise you about that. I'm sorry I can't advise you that openly here. Now, I'm continuing. My sister once has that problem. The doctor gives her the wrong medication and she nearly lost her life. Yes, I want you to know that when you visit a doctor's office, the one that I've texted, that Benjaokwesh, that is my email address. Text me there. When I get it, I'll advise you more. Abina, that's for you. Now, when you visit a doctor's office, this doctor is trained. This health practitioner is trained to do some things to the level that this doctor is required to, not to do things above the level of his training. So when you go there and then you start, let me give an example. You have a cough, a normal cough from a flu, and then you go to a hospital. You are given an chest MRI, chest X-ray, full hemogram, CRP, you see. And this is a person that has no insurance. You've gone to a hospital for help. First, what are you doing? You are torturing this person beyond the disease that this person has. Second, what are you doing? You yourself, you are making things worse. Because the first thing is, you're not sure of what you're searching for. Your training has allowed you to narrow down to a specific, from the symptoms to whatever impression that you have that can be having problems to this person. So from a small flu to a mental complication that you are giving a patient, you see, to financial depression, because this person needs to check more money for all these tests, and then you'll tell this person, there is nothing I've seen, you just have a flu, go and take this and you'll be okay. The other complication comes, if you have narrowed down to all those, do you have the capability of giving the right medication even to that simple cough? But if you are a person that have been following these medical channels online, like YouTube, like Benjamin the Wise Guy channel, other channels like I have seen the NAD. There is a guy who would really have good channels called the NAD something. If you've been following, instead of just following some channels of entertainment, you give your time to follow channels that can educate you on some matters of health. You will know that this doctor that has written me all these tests, all these things that are here, does not know what he's doing. You'll go to the second opinion before giving out your money to do what? And giving yourself mental torture. You get it? So medical journals and talks on YouTube, on other platforms are very important. They make you avoid more complications that may arise from SAE. Right about now you're here. Thanks for tuning in. You see, the Jamaican uncle has said, my sister once has that problem. They give wrong medication and she nearly lost her life. And that's why when people you have not qualified as a doctor, doctor's assistant, a nurse, you have to work under someone for 1 year under internship before you are released to work for yourself. So let's get to understand this. Let's get to follow medical journals. Let's get to follow medical journals to get some medical tips, because this is life. This is life, and life is what we preserve daily. As you wake up, you are trying to hustle as you preserve your life for future. Okay. Following medical advice can improve quality of life. It's very important. Advices. Why should I come here and talk about medical advices? It's important. It improves the quality of life. The quality of life means proper treatment and health habits. Proper treatment and health habits can help people live longer, healthier, and more comfortable lives. I've just been talking about some things that are not good, like free radicals always. And now people have opened their eyes knowing that, so the things we do are the ones which are bringing us these free radicals. And free radicals come from smoking, fried foods for long, you see. And they open their eyes and they stop smoking and they stop eating a lot of junky food, And then you feel nice as you gain your weight back, as you kick cancer out of your life. Improving the quality of life. You understand that? Improving the quality of life. Quality of life is very important, because a healthy person does more better things and thinks straight than a person who is having complications. Even mental health challenges may have come on from the people that are injured physically. See, remember, if you have any question, ask. If it is a question that I can answer here, I will. If it is a question that I won't answer here, I will give you my email address so that we can interact and help each other. Remember, your question, if it is confidential, it is well kept. We talk about medical issues online to avoid complications. To avoid complications like controlling blood pressure can end up a person to get a stroke. So when you come here, you understand some people don't like taking medicine. Even when they are at risk, they say, I don't like this medicine, and they give me stigma every time. But when you come online and you meet a person like me or my other colleagues that have the same platform like mine, and they talk to you, because sometimes when you meet someone physically, it's different from online media. Because you have seen some people have white coat hypertension. When they go to a hospital, their pressures go high, but when they are home, it is okay. So when you are at home and you are watching Benjamin the Wise Guy, and Benjamin the Wise Guy is laughing, feeling nice, making you smile, because here is where we come and smile and we listen to reggae music and some other music and we talk openly. You start getting that advice with calm. Yeah? Like now, you who is watching me right now, listen, you who is watching me, you see, you are feeling nice watching me. As I advise the people, as I advise you, you feel nice. So online medias are very important. They are important because at your own designated place where you are, at your own designated place where you are, you can just tune in, get the advice without feeling shy or feeling that stigma of going somewhere like in a hospital with doctors who are serious. That is the importance of coming online and talking about medical talks, medical preventive measures, stigmatization. You have seen people that talking to them is hard, but within their vicinity places where they are seated, they can go through a phone and study about that thing that is hurting them or going through. So my friends, welcome. If you are new, remember, come to the chat and tell us where you are watching from. Tell me which side of the country you are watching from. And don't fail to subscribe. Don't fail to subscribe as we talk. And if you have a question, please don't fail to ask your question. Questions are important. Questions help us to understand important facts about our lives. And they help a doctor to be challenged. We also like being challenged. You see, a person who does not like being challenged has a problem. Today I'm watching from Manchester, Jamaica. Whoa, okay. I like that, Sir EA. And share this good talks to your people around. Judy, welcome to the platform. If you're still here, thanks a lot. Abina, I know you will email me. Wamwandu from Kenya or where? Wamwandu, which country are you from? Share Travels. Thanks for tuning in here, and all those that have been watching, even including the new people that have just subscribed to the channel. Very important. When you are, I've said, when you are healthy and you don't have problems, or in your family you have not faced a problem of medical situation, you will not understand the magnitude of having a medical knowledge. You will not understand the magnitude of understanding medical knowledge. But when you understand the magnitude of having a medical knowledge, you will always be tuning in to Benjamin the Wise Guy and asking some questions. But it is important we create even the social circle, social bank. As we are watching, we are relating. Like Sir E is watching from Manchester, Jamaica. You see, Judy is watching from Kenya, and Jamaican uncle from the US, and we are relating here, and we are talking and having, when you talk to the people out there, even the boredom and the mental health stability becomes better. See, so preventive advice include vaccinations, the role of vaccines for us. We have talked about what vaccines are. We have discussed a lot about vaccinations, like polio, influenza, hepatitis, measles. Some people here in Kenya always thinks, in Africa, let me say in Africa, always thinks vaccination is for Africans alone. People think vaccination is for Africans. Vaccination is for everyone. So if you are in Africa and you have been thinking people receive vaccines because we live in the tropical regions, even out there, and people can attest, people can travel and they get the vaccine. And it's very important to get the knowledge to the people that are young parents. People that are young parents. Because I've seen so many young parents, they don't know the importance of vaccines. They have children, but they don't take these children to be vaccinated. All the time on social media, going to parties, young parents, stay guided by your aphasia recovery. Thank you so much for tuning in. I can see you. Stay guided by your elders. You see, don't say that our elders are old folks. They understand their old ways. The old ways are the foundation of a good, healthy life. The old ways. And as you say so, the old ways are more people were less sick in the old days rather than now. So many complications are arising right now to the younger generation rather than to the older generation. Why? Because the young parents neglect the most important thing and they see bigger things that are not very important concerning life. You see that? You see? So you as a young parent, if we have young parents here, and if we are older than the young parents, we should know how to help these people. Nowadays, young parents, people don't, in our times, we were forced to do things and we were taking them positively. That is, I'm talking as an African man, a man from Kenya, Africa. Parents had the capability of forcing you to do what they want. And it turns out to be positive and you enjoy it. But nowadays you can't force a child to do what he or she doesn't want, So medical advices are important when it comes to vaccination. Yes, Kenya, Africa. I once was brought a child. Chacharaz, I've been looking for you, doctor. Yes, Queen had told me you've been looking for me. I'm good, Chacharaz. You have my number, or you can ask anyone my number. You WhatsApp me, Chacharaz. We will discuss what. Queen told me you have been looking for me. You see, I once was brought a child in my office. 7-year-old who was sick, and I told this child that now because it's your disease, I have to give you an injection. The child told me, but you can't force me to give me an injection. It's my right to say no. Okay, Chacharaz. Okay, Chacharaz, text me on benjaokwesh@yahoo.com. Chacharaz, text me on this email. I'll give you a number that you will. benjaokwesh@yahoo.com. Just imagine a 7-6-year-old telling me that you can't force me to give an injection. Times are changing, and as times change, more critical issues arise. And as more critical issues arise, as the older generation and the parents, we really need to have a way to help this generation on how to bring up children. Sha travels, you are laughing. We face these things. You see, what if a 23, 24, 25-year-old mother tells you, I don't want my child to be injected? And you as a doctor, you know very well this child needs some IV injections to be better. These are things that we have faced. You see, these are things that we have faced. So medical advisors and medical journals are very important. They help some people to think straight. You have to go with that, the parents say, even though you know they are wrong. For me, I don't go with what a parent has said. I will never, as a medical practitioner, if you don't like my advice, I let you sign against the doctor's advice. Then I will send you to another facility. That is what I usually do. If you are following the medical protocols, don't go against the medical guidelines. If you know this parent has the right to whatever he's saying, or she has the right to herself, and you know this is the right thing, my secretary always comes smiling and tells you it is your right to not to agree with the doctor. So we will just advise you to sign for us, and then we will refer you to another medical facility with good faith. It helps you to avoid very many things as long as you have the evidence. You gave the medication written, but it went the other way round, and there is a side document saying that the recipient or the parent did not agree. Very important. But you see, these are things that arise when people don't get the right medical advices. In Africa, some people say when you are sick and you go and get some diseases, doctor, sometimes the patient is scared. Yes, being scared is normal, but you give this person time to go and think. But what if there is no time to think? You have to refer. Referral is a way of management. Referral is a way of management because you tried, but you referred this person to the next person to try and contain them. Instead of taking this person, telling this person, go home, no. Coffee cake stands. Refer this person to the next facility to get another doctor. Maybe that doctor will convince the person and save life. Here in Africa, there are some places you go. In my community, there are some diseases, people, you can find a person getting so high fever and convulsions sometimes. And when they are taken to the hospital, they tell the doctor that this is not a disease. This is a curse that was sent by someone in the village, and if you give the injection, this person will die. And seriously, if you look at that person, this person needs some antipyretics like paracetamol IV, or else this person will die. So before the commotion occurs, you explain, this person is deteriorating. And that is why superstition, superstition. And that is why it is very important to come to these medical journals, to come to these medical journals and advise. As the people come to YouTube and they go through this, and they go through these talks, they come and they start knowing that out there have embraced. Why not us? Why not us? This is the importance of medical talks and journals. Understanding the medical world, understanding the medical world. And as I've said, if you have not been in your family, in your place of work, your friend, you have not come across a person with a chronic disease, you will not know the magnitude of having medical education. Very important. Very important. Yeah? It is important to know how to manage chronic diseases like hypertension, diabetes. You have seen some people have withdrawn from taking anti-hyperglycemic agents for diabetes, and they say, my friends, please check on the journals also that you are watching. A person may say that, nowadays I'm just taking herbs and I'm okay. The medicine for diabetes were not helping me, but nowadays I'm okay. Let me tell you, my friends, this is a very scary moment when you are brought a patient with a situation called diabetic ketoacidosis, unconscious. You don't know even the medicine that this person was taking. You don't know where to start from. You ask the relatives. This person is unconscious. Sugars are so high. He's having a diabetic ketoacidosis. Which medicine is this person taking? On your documentation in the hospital, you find that this person was taking something like metformin 1000. But at the seeing of things, this person has not been taking the medicine for more than 2 years. This person have been taking some things that are not medicine, herbs, saying that herbal medicine is everything. For any chronic disease, my friends, any chronic disease, listen to your doctor. Only take contemporary medicine when your doctor has advice. I mean contemporary, I have not said alternative. Because contemporary medicine may work along with conventional, the drugs we use in the hospital, plus integrated drugs from the line of herbal that may help. And it does not mean replacing. This is a chronic disease, and as per research, and I've said scientific research and proofs, we know it will work like this. So if you are a person that you don't have that medical, we have seen so many herbalists out there. In my country, there are herbs that help people. But you see, the people that register these herbs, we have two boards. We have the Kenya Medical Practitioners and Dentists Board, and we have Kenya Medical and Kenya Pharmacist Board, and we have something that is called the Heritage, Ministry of Heritage. So the Pharmacist Board works with hand with four boards. The Pharmacist Board work in hand with Kenya Medical Practitioners and Dentist Board, Medical Practitioners and Dentist Board. These are doctors. We have Nursing Council, nurses, and we have Clinical Officers Council. How many boards? So the drugs that are used in hospital, they work hand in hand with these four boards. Trained personnel that practice conventional medicine. But we have another board here that is called the Ministry of Heritage that embraces our culture. And we have the contemporary medicine that they have been working since by our forefathers. They are given licenses. Some of the people are giving licenses to distribute them, which is okay. Contemporary medicine and herbal medicine, which is okay, because we embrace our culture. But never should you replace the conventional medicine if you are having a chronic issue with alternative medicine. Alternative medicine is when you are now using the herbs again and you are saying they are used. You will always come to the hospital when you are unconscious, not able to help yourself. You get me right? All these people that say alternative medicine is helping us, they all end up in hospital at a bad state. Check out on which medical journals are you following? Is it complementary? Is it conventional? Or is it alternative? And when you are watching on alternative and complementary, be careful not to follow the wrong advices. Follow always medical journals that are from people that are professionals, one, and qualified and approved by the boards that are needed. Very important. The importance of following the true media. Very important. And I want to say something else. Let me take my green tea to remove some antioxidants and free radicals. Green tea for life. As the world continues to evolve, because the world evolves every day, medicine continues to evolve too. Medicine evolves and changes as science evolves. So you have seen some years in the 90s, we didn't know something like COVID, didn't know something like Ebola, but they have come, and science have to make their way. Will you not return? Where? Welcome, will you not return? I don't know how to read Hindi, so I think that one is I can see will you not return. So welcome to the channel. If you are new and listening to me, please make sure you hit the like button and subscribe to my channel. Subscribe to my channel. You will get some good advices like this one that saves life. That saves lives. So as science evolves, new complicated diseases evolve. Upgrading continues. So watching journals and media like the one that I'm presenting is important, because I'm in the system, working in the system. Dr. Thought on Holistic Medicine, apothecary, acupuncture, pressure points. Yes. Now, coffee cakes, that is what I'm saying. Whatever you are saying, like apothecary, acupuncture, pressure points, that is complementary medicine. It is not alternative. It is important. That is under all complementary. Complementary works along with conventional. So, if it is complementary, it's okay, but don't abandon your medication. So that is right. That is okay. Yoga is a form of medicine that is complementary. You see, very important. I remember we were to talk about these things at our talks on complementary medicine, but time took us around. We will come back and talk about acupuncture. We have so many. We have so many. So that is complementary medicine, and it is okay. So we have said as medicine evolves, new things come. It's good to be, talking online, feeling nice, enjoying ourselves. And as we enjoy ourselves, what do? We get to understand the real life situations. You don't need to go to school to understand. Just get qualified personnel, interact with them, find the real thing. Ebola struck, and then we came and discussed Ebola here. And you saw, most people are appreciating what Ebola now is. And if you look at now, if you ask people who are on that talk, on the video that we did on Ebola, they'll tell you Ebola is an hemorrhagic fever. They understand when you tell someone Ebola is a hemorrhagic fever. Very important. And when you see now the sign of hemorrhagic fever around a place that you are, you know the rightful measures to take, instead of giving yourself another Ebola. You see, these are things that we talk and understand as we feel good, We don't talk as we feel bad. No, we talk and understand as we feel nice. So if you have any question, don't fail to ask. Ask your question, my people. Ask your questions, and let's continue to understand why it is very important to do what. Let's understand why it is important to follow journals like mine. And not mine alone. We have so many people doing the same thing as I'm doing. Health is important. And our generation, the generation that is now here, it is deteriorating on health issues. Bonfire I7, Bonfire. Welcome, Bonfire. Thanks for tuning in. Hope, Bonfire, you have subscribed and you are following these talks. And share them to your friends. It is taking 3,000 units of vitamin D3 daily. Okay, 3,000 units D3. 3,000 units is good, because an injection for a month is around 7,000 to 9,000 units. So vitamins are needed in your body daily. So that is okay for me. D3, especially when you have osteogenic imperfecta, a problem that occurs in your body, and your bones are not able to be okay. They are stiff. They are just breaking on themselves. But I would like, before you give these supplements, there are several things you have to do. And the problem you have is what guides the physician or the doctor on the amount of vitamins, injection or supplement that you are supposed to be having. So D3, get some vegetables, get some good food, and you'll be fine. But if you are under supplementation, please take the supplementation. Some people have, I hope that is correct, coffee cakes. You've got that right. Okay. Medical advice: consider your medical history. People have chronic medical histories that they don't understand. Family medical histories that they don't understand. So for me, it is important to check and be advised. When it comes to family issues of complications, most of the people sometimes they live with them and say, we are used to this, even my grandfather had it. But when we were talking, let's rewind and look at the talks that we had on neural tube complications. Here's the situation. I have low vitamin B, and the doctor now wants me on 2,000 units per day. However, I also need to take vitamins and add 1,000 more units per day. It's okay if the doctor said it's low and you need supplementation. It is important to take, because several situations may hinder you from getting vitamins. And vitamins are called cofactors. Cofactors are things that help your body. Like, let me give a situation of muscles and tendons. There is a situation whereby your tendons should be tough. Vitamins come, especially D3, comes to be a cofactor on some units in your tendon so that they can be tough. So if you don't take them, you become flat and your body becomes weak. So if your doctor said that is important, coffee cakes, please take it as is needed. So my friends, you see, we have so many important messages when it comes to medical talks, even social life. Even doctors themselves, you see, they undergo some social challenges that come in the hospital, and you have to be prepared for them, because the people that come in hospital, they didn't have the teaching outside there. They don't understand. They are seeing the doctor just as a human being and not a person who has undergone training on what that he or she is doing. And that is a very important challenge, significant challenge in a hospital. Seeing a doctor as a human being and not a person who has undergone the training on what he is doing. It is what makes people have problems and end up getting medical situations. Some people self-medicate. I've seen people coming to a hospital and then they tell the doctor, no, don't give me this, you just give me this, I'll be okay. You get those situations. These are life situations that are out here. And they are faced daily and daily. Because, the world of access to media and everything has made people nowadays, they know. Because someone has gone to online, you have learned about ABCD. Even if I train you here and tell you about something, or a person on this chat and I explain about something and you catch it, don't go to a doctor and start telling the doctor you know it all. No. The training that this physician has undergone over years is more diverse than the little that you know. Medicine is a diverse way of doing things. The years that doctors, physicians undergo for training means that it is a critical training. So as much as you know on we talk, you have the knowledge. Yes. And if you go to a medical practitioner's office and the medical practitioner's office, this doctor, this nurse, this person is telling you to do this and this because this and this. Just ask why, let the doctor explain, then take it. You see, to prevent mistakes of medical treatments. You see, these are many things that we look at, and then you have seen so many physicians, doctors, nurses, doctors' assistants, clinical officers have been taken to court, and those cases never go anywhere. Why? Because according to you, you were not given as per expected. But according to the protocol of medical practice, the doctor was, or the practitioner was expected to do what that doctor did. But because of your confusion and anger and reading on it ended up you to suing the doctor wrongly. So it is good to ask a physician or a person who is treating you, always ask this. Why this medication? Let the doctor explain. What is my diagnosis? Let the doctor explain. Be curious. It's not a problem. It's not a sin to be curious. It's about your health. If you see you are being curious and the medical practitioner is not giving you enough, walk out. Go to the next one. Medical advice supports mental health. Very important. Like when I come with a feel good evening, feel good Friday, let's juggle up, welcome to Jamrock. We feel good as we talk about mental health. Yes? Health providers can offer guidance for stress, anxiety, depressions, and other health concerns in a right way. You see the importance of having medical journals. These are the importance of having medical journals. YouTube is like walking in a street in the world. walking in a street in the world. You turn right, you see a madman. You turn left, you see a smiling woman. You turn you go the next lane, you meet someone who is talking to you about prophecies. You see, this is now a world, a market, the whole world. You turn on your back, you meet Dr. Ben talking to you about, you see, he's talking to you about medical talks. Choose the right things to visit, pages to visit that can help. And not only you, let's help our generation, our children, to choose the right the right. I usually tell people, if you deny your children the right to media, you'll be doing a wrong thing. If you deny your children the right to, because I've seen some, you'll be doing a wrong thing. I've seen some parents that when children are home, they can't watch television. The Wi-Fi is encrypted and everything is. The best thing to do for these children is to train them to know the right thing to follow. It's just like when you take your child to a boarding school, where this child will meet people that take alcohol, people that smoke bar, people that do all sorts of, insensitive things. But you trained your child well, and your child is not associated with those all. You'll find your child going for prayers in the evening and the CU Christian Union department. For 4 years, the child will be there going there because you trained your child well. So don't deny your children media. Give them, discipline them on which media to follow and what time to follow and what is the right time to be on media. Media is not being shut down tomorrow or coming day. It is here to stay. So train your children the right media to follow, like educative channels, right songs to follow. Very important. The world has normalized negativities, insensitive things online, and the platforms are not bringing them down anymore because some of these insensitive things are making money for them. And the people who are supposed to bring them down, careless, money is flowing. So that is it. The importance of learning medical, following medical journals and medical talks on this platform. If you have, I can see Building a Legacy is here. Welcome, Building a Legacy. Thanks for joining the talk. So if you are here and you have that burning thing in you, something that you have inside that you want to say, please bring it out. Let's discuss. Warning signs. Warning signs of medical practice. Warning signs. It is better to know first aid and warning signs of specific diseases that are not good. Complicated diseases. It's good to understand and know the warning signs. So if you visit Dr. Ben, we have talked about warning signs of crisis of hypertension. We have talked about so many things. Visit someone else. When a person is starting to have severe headaches, you know what to do. The first aid emergencies of a person has taken some bad concoction, you know what to do. Someone has got trauma and is bleeding a lot, you know what to do. A person, we have just been talking about bleeding complications. When a person wants to start to bleed, and you know what to do. Convulsions, we have talked about them. If you are following and you are near a person who has convulsions, you know what to do. You will not end up taking sticks and wallets pressing on the mouth. No. Put the person in a recovery position and this person feels good. If it continues for more than 3 to 5 minutes, you rush to hospital. Those are things that we discuss and they help people. But I'm still insisting, reliable medical talks comes from professionals, qualified professionals with the boards of their countries and states. So find out, are you being guided with a person who is qualified and given the license by the state, or are you following a quack? Very important. Hospital, clinics, government health agencies, and qualified professionals are trusted sources. Getting a quack in a government hospital, there must be a problem. Check at the hospitals that you are going in. Are you consulting a health practitioner, or are you consulting a quack? Very important messages that people should follow. Medical advices promotes healthy habits. That one is very important. They promote healthy medical practices. Let's promote medical practices that are healthy, medical practices that are good. Let's not promote things that are not worth it. And also, as the financial crisis continues, taxes are high, things are hitting hard. By you knowing some tips on medical emergencies and first aid can save so much money. By you getting the tips on how to know this person is a quack can save you a lot of money. And if you have been following someone like Benjamin the Wise Guy, you already have the tips. When you go to a person and this person is masquerades as a doctor, there he is, and he's saying things, you'll start learning that whatever that this person is prescribing is not what I've learned on some journals that I've been going through. So you'll go to the next opinion without getting the wrong prescription. See? Better prevent than treat. Better prevent than treat. Very important. You see that? You are pregnant for our women, our lovely women that are at the conception age. And you are going to people that are not qualified. You can lose your baby, you can lose your life. You can get a baby with convulsions, with the issues. So you see, very important for medical talks, medical journals, medical practices. Very important, very important. So I've really talked a lot, and people are listening so slowly, keenly to what I'm saying. What do you think about what I'm saying? Advise me. Advise me a bit. Advise the doctor now. What do you think about the doctor? What do you think? Is what I'm saying vital, or is what I'm saying shenanigans? But I know most of the things that I'm saying are things that have happened to some of us, and are things that have happened and you have seen them, and some people have disabilities right now. because of not getting the right advice. See, I have how many minutes to go? Oh, 15 minutes to go. I have 15 minutes to go, guys. What do you think about this? It is important, and you can attest. The Jamaican uncle has said here, the sister got the wrong medicine and was about to lose a life. Here in Kenya, I saw news, a person doing laparotomy. You know what laparotomy is? I don't know if they said. I think what you are saying is very important, doctor point of view. Thanks a lot, sir. I really don't know if they said, I saw it on news. No, don't leave us, we will cry. I is saying I don't leave. Imagine a doctor who is doing laparotomy. Laparotomy is surgery of opening the stomach. You open the stomach and then you see the problem, you do what you have to do. Or in a clinic, not a theater, the patient ended up dying. There are some surgeries that are really meant to be done in theater with a team of theater nurses, anesthesists, doctors, the specialist doctor, plus other doctors. But I saw laparotomy being done in a clinic. I've seen those videos and I was, gosh, was this a doctor or a what? You don't know the point that I'm leading, the point that I'm driving. If that person could have knowledge about medical tips on how surgeries should be done, the person could not allow the doctor to do that laparotomy in a clinic. No theater session, no theater setup. You give local anesthesia to do a surgery. Quackism in nature. And you call yourself a doctor. You see, those are things we have to prevent when it comes to medical. And that's why we come online and talk. Because it is only online nowadays that we can give message to the public, so that we cannot be getting these things in the hospital and you don't know where to start from. You call a team, you start discussing, where do we start from? Do we start some things you meet in a hospital, sometimes you can cry or you can laugh, or I don't know. Some doctors avoid some situations because of, let me not say that word. Medical advices promote overall well-being. Like you who is watching, you see you are feeling nice. You are feeling nice overall because you are appreciating the message that is coming. It is important when you deny medical treatment because you have noticed something that is not correct for you. Don't say it in an agitating way. Just tell that person, yes, I've listened to your advice and what I think. yeah, Sha Travels, thank you a lot. You see, tell that person, I've listened to your advice. I will sign the against doctor's medical advice, and if I feel I can come back, let me just come back. But there are some people who can make storms out of teacups. Just leave that person and go to the other person. Mental health is a good thing for every person, the doctor and the patient. There was a time during COVID whereby more doctors were committing suicide. Why? Because of the mental torture that they were undergoing. Follow-up is an important part of medical care. Follow-up. follow-up is very important. And as I usually say, my friends, as I usually say, yeah, thank you, Sha Travels. Thank you so much for your appreciation. You know, this is part of therapy. What Sha Travels is doing to me is part of therapy. Appreciating Sir EA, Jamaican uncle, building the legacy, all these people that appreciate. It is therapy towards me because you feel nice when you are helping. When you are helping. Very nice, very important. It's therapy even to the doctor himself. Every doctor that has done a surgery and the patient has woken up in theater from, yes, Efasi is here, my friends. Let's welcome Efasi Lipenga. Welcome, Efasi. Yes, good to see you again. And a patient has woke up from anesthesia, walking and without pain. The doctor smiles because the doctor knows I did the right thing. It is like a tailor, let me say a tailor who has given the best, and the person who has bought that dress is walking out there and every person is asking, who did this for you? You get that feeling, man? You get that feeling, eh? Yes, I feel that you are saying will help us understand the need for medical confusion and procedures. Yeah. The out here, people don't know how medical procedures should be. So that feeling, the doctor feels good. Even doctors are human beings. Even doctors are human beings, and their health mentally matters. Sometimes people don't know even doctors can fall sick. I'm sad to say that. I'm sad to say that there are some people who don't know even doctors can fall sick. See a doctor coming on duty because you are the only specialist. You are sick, but you are still being given calls. Yes, and it's not good. We need to be taken as human beings. I've said these things that I'm talking may make at this financial era, currently things have been sort of for many people around the world, and saving is a better thing. So the advices that are being given, even if a person is sick, it can save money for the family. If you go to a quack or a person who doesn't know what he's doing, a complication can need more money. It can bring more stress because of court cases and medical advices guides safe use of supplements. And you see, when we talk about supplements, we just have a question from our friend Coffee Cakes asking about vitamins D3, and I've explained so well about supplements. Get supplements from the rightful distributors first, in hospital, prescribed by a professional, and use supplements that are being guided the right way to be done. Especially vitamins. There are so many people sometimes who get toxicity about vitamins. Vitamins are needed in your body always, but once you take them at once at a very high grams, or here we use kilograms or so, they may injure your liver. Your liver function will become a problem. So very important to follow doctor's advice. Hmm? See, everything that I've been talking about for more than 1 hour, how does getting knowledge and facts on journals, on YouTube, and other places help you as a layman or a medical profession in the medical field in a social life? One, it prevents disease. Two, promotes healthy living. Detects illnesses early. You can see Coffee Cake says interesting. Guides treatment. Yes, reduces complications and improves quality of life. And the most important thing, helps people to make informed decision about their health. No one can make a decision for your health. No one. You have the right to a life. So informed decision. I'm not saying a decision. No. Before you make a decision in hospital, you should be informed. When you are going to a hospital and you meet a doctor has told you that you have this and this, and maybe you can find a very rude doctor and tells you, I've told you that this is either you do this or you walk out of here. That is very bad. Some doctors will tell you, I have a lot of work to do. Don't waste my time. Kindly, if you are watching me and you are a medical practitioner, a nurse, a clinical officer, a doctor's assistant, take your time with your patient. Make your patient understand the situation. Let your patient make an informed decision on what this patient will be done, will needs. Because even giving paracetamol, Brufen, those that people say those are just minor painkillers, it needs informed decision. It's a drug. You are there to practice what you need and let the patient decide whether to take your word or walk away. Mental health. Don't struggle in frustration with the patient. Don't struggle in frustration with the doctor. Vice versa. You as a doctor, you have given the right information. Let the patient say, yes, I need the drugs. You as a patient, you have been given the advice by the doctor. You see, don't fight with the doctor. Give the consent to the doctor. Let the doctor give you the medication, or yes, it's up to the patient to follow the doctor's advice, or tell that doctor, let me find a second opinion, maybe I'll come back. Why be in frustration? I once treated a patient, and because of circumstances that are not medical, patient told me, we have many doctors out here, why do we come to you? And I told the patient, I don't know, maybe you tell me. But the patient went around and still came back. My way of practice is one. I'll tell you your problem, I'll give you your time, and tell you, I have done this test because of this and this. I have given you this drug because it does this. Are you ready to receive it? Yes, I'm ready to receive it. Thanks. No, I'm not ready. Please I will refer you to another doctor or your doctor's choice. If you feel you are not contented with them, come back, then we try. That is my way. So guys, thank you so much for tuning in. It has been a very good session. Very nice session after I've been away for some time. But I thank you all for tuning in and being with me till this time, Dr. Ben. And please follow the right channels and share this information. This is a very important information for some people out there. Be blessed, and maybe if you have any question, you can bring it up. We can meet some other time today. Wherever you are, may God protect everyone. The anointing be with you. Bye bye. See you guys. Thank you so much for tuning in my chat. God bless you. Don't eat too much. I'm taking this. Bye.